In the early 1800s, doctors in the United States were using hawthorn to treat respiratory and circulatory health disorders. The hawthorn fruit, leaves and flowers are all used medically today. Hawthorn fruit comes in the form of little red berries. Native American tribes enjoyed eating them, and they also used hawthorn to treat heart troubles as well as gastrointestinal complaints. What makes hawthorn berries so medicinal appears to be the number of flavonoids. The flavonoids are potent antioxidants known to effectively decrease inflammation while boosting immune function. Eating a diet high in flavonoid-rich foods, beverages and herbs has been linked to prevention of cardiovascular and neurodegenerative disease as well as cancer. The hawthorn herb is loaded with health beneficial compounds. These compounds have been shown to boost heart health. Hawthorn's antioxidant flavonoids improve blood flow, guard against blood vessel damage, and even help to dilate blood vessels. These flavonoids include OPCs. OPCs stand for oligomeric protoanthocyanidins. They're some of the most prevalent polyphenic substances found in hawthorn and in other plants. Some of the many chemical constituents found in hawthorn are the flavonoids, quercetin, vitexin, rutin, choline, acetylcholine, caffeic acid, vitamin B1, B2, vitamin C, calcium, iron, and phosphorus. Hawthorn berry is best known for its helpful toning effect of the heart as a cardiotonic herb. Hawthorn has shown itself to be impressively helpful for all kinds of serious heart concerns. These include heart failure, heart disease, angina pectoris, changes in cardiac rhythm, and atherosclerosis. According to a 2016 study published in the journal Current Medical Chemistry, hawthorn's powerful heart benefits come from its high polyphenolic content. To date, research has shown that hawthorn can even have a helpful effect on congestive heart failure. Multiple studies have shown that hawthorn supplementation has resulted in improvement in cardiac function based on a number of parameters. These parameters include blood pressure, heart rate, cardiac output, and exercise tolerance. One trial in particular gave 78 patients with NYHA Class II heart failure a commercial preparation of hawthorn leaves and flowers. After 2 months, the patients receiving 200 milligrams of hawthorn 3 times per day had an increased working heart capacity, as well as a reduction in symptoms. The hawthorn group also showed a decrease in systolic blood pressure during physical activity. Another German study also showed that hawthorn extract worked nearly as well as a prescription heart failure drug, and that the hawthorn extract had fewer side effects. Another cohort study of 952 patients with heart failure had subjects taking a hawthorn extract either alone or an add-on to a conventional treatment. After 2 years, fatigue, stress, dyspnea, and palpitations, which are the main symptoms of heart failure, were all significantly decreased in the group who took the hawthorn compared to the group who did not. Many herbal practitioners recommend hawthorn berries, flowers, and leaves as a natural blood pressure reducer. A scientific study published in the British Journal of General Practice had 79 type 2 diabetic patients either take 1,200 milligrams of hawthorn extract daily or a placebo for a total of 16 weeks. Hypotensive drugs were also taken by 71% of the study participants. The hawthorn group experienced greater reductions in diastolic pressure, but there was no group difference in systolic blood pressure. The diastolic reading, or the bottom number, is the pressure in the arteries when the heart rests between beats. This is the time when the heart fills with blood and gets oxygen. Over the years, research has found that both numbers are equally important in monitoring heart health. However, most studies show a greater risk of stroke and heart disease related to a higher systolic pressure when compared to elevated diastolic pressure. Decreased blood flow to the heart causes chest pain, which is known as angina. Sometimes it's confused with indigestion, but true angina can be a symptom of coronary heart disease. So far, research is showing that hawthorn may be an effective natural remedy for avoiding and for treating angina. According to a scientific article published in the Journal of Herbal Medicine and Toxicology, hawthorn's bioflavonoids help to dilate both peripheral and coronary blood vessels. This can improve blood flow to the heart, making hawthorn very useful for angina. Hawthorn's pro-anthocyanidins are also believed to reduce tension of the blood vessel walls. Again, this is very helpful to discourage angina. In one study, 80 subjects aged 45 to 65 with stable angina pectoris were randomly divided into 4 groups. The first group was the aerobic exercise group. The second group took a hawthorn extract. The third group did aerobic exercise, plus they took a hawthorn extract. Finally, the fourth group was the control group. After 12 weeks, the researchers found that the combination of aerobic exercise and hawthorn supplements were an effective complementary strategy to significantly lower the risk of atherosclerosis and heart problems. Animal studies have shown that hawthorn berry extract may be a helpful natural remedy for the reduction of LDL or bad cholesterol from the body. In China, hawthorn is called shanza. A study using animal subjects showed some really impressive health results from an ethanol extract of the hawthorn. The 2016 study revealed that the hawthorn berry extract not only reduced overall high cholesterol levels, it also notably decreased LDL cholesterol, liver cholesterol, and triglycerides, as well as body weight. Some research conducted in 2008 revealed that hawthorn berry extract is excellent at decreasing inflammation. This is huge for health, since we know that inflammation is one of the root causes of most disease. The research also shows that the extract of hawthorn berry is a free radical scavenger. This is extremely beneficial to human health, since free radicals can cause cellular damage, including DNA damage, by stealing electrons through a process called oxidation. A 2008 animal study also demonstrated how hawthorn berry extract has protective effects for the gastrointestinal system, and it appears to successfully kill off various types of unwanted bacteria. Some herbalists consider it to be an adaptogen, with its berries being given for physical heart complaints and its leaves and flowers being used for an emotional heart-related problem. There's a few options of how you can incorporate hawthorn berries into your life. You can opt for hawthorn berry tea, either pre-packaged or loose. Loose hawthorn berries can often be purchased in bulk. You can also pick up hawthorn supplements in the forms of a capsule or a hawthorn extract in a liquid tincture, such as alcohol or glycerin. So far, safe hawthorn doses appear to be between 160 and 1,800 milligrams per day for 3 to 24 weeks period of time, according to studies. Noticeable improvements in symptoms may take 6 to 12 weeks. It should also be known that hawthorn is related to apple, and many people make jams and juices from hawthorn and eat it in excessive quantities.